Warning: this episode contains discussion about suicide and suicidal ideation. If you are anytime triggered by the content of this episode, please stop listening and seek support from a mental health professional or crisis worker. If you or someone you love is currently suffering with suicidal thoughts, please seek out the care that you need and deserve from professionals that are ready and equipped to help you. You are not alone, and it is not too late. In the United States, call or text 988 to receive professional support from the Suicide and Crisis Lifeline. The support is free and confidential and available 24/7. We love you. You can make it through this.
Oh, you open up a world behind stars. Oh, you make me see the things I never saw. We don't need no miracle. I think we've seen it all. Just make the call. I'll come running over. We don't need no...
Welcome everyone to Hystericology podcast. I am here, Elizabeth Beckmann, with
Andrea Hanson.
and we are actually going to be talking about something a little more serious, a conversation that we thought would be important to have after some recent events here in the Valley with a mental health professional. And I know, Andrea, you reached out to me first and had asked, had I heard about this? And you had a little bit of a closer connection, there being some overlap in the work that you do. We thought it might be really valuable to have a conversation about suicide, about the cost of not getting support as mental health professionals.
What we hope to accomplish in this conversation is to have a discussion around mental health therapists, mental health professionals, whether they're psychiatrists, neuropsychologists, psychologists, social workers, mental health workers, having honest, real help from mental health professionals themselves. It is a very pervasive problem in our community as mental health professionals. 4% of mental health professionals have attempted suicide, as opposed to 0.5% of the general population. Survey showed that 59% of mental health professionals have thought about suicide. That's a hugely pervasive amount, and it's really not talked about. And it not being talked about is part of what leads to the stigma that blocks that help and support from happening. And by stigma, I know we throw the word stigma around a lot, so I want to kind of define stigma here. By stigma, I mean when we make it so that if somebody is something or feels something or engages in something, like sees a therapist, then they are defective, they're undesirable, they're unwanted, they're unwelcome, they're bad, they're unfixable. We create these labels, and some of that is external, but a lot of it becomes over time internalized, where we feel like, as mental health professionals, and I know this is everyone in general as well, but as mental health professionals, if I need to see a mental health professional, if I'm not okay, then there's something just horrifically wrong with me. There's something very bad about me. So I can't need to see a therapist. Or if somebody finds out that I see a therapist, then everything's going to fall apart.
Yeah. Well, it makes me think of a couple of podcasts ago when you were talking about, for example, in the teen treatment industry, how someone you worked with having a history of going into and receiving treatment in that setting, how they were treated differently by the professionals they worked with. And this is as an adult, someone who was fully trained, were treated differently, like they were a detriment to the team, or somehow they were a weak link, versus realizing there's a value there in that personal experience. And I know for myself, as a mental health professional, I have family history, biological vulnerabilities towards depression, towards ADHD, towards anxiety. And I know myself, I have experienced mental health issues. I have experienced depression. I have experienced not wanting to be alive. And there were physiological reasons for that. There were mental health reasons for that. But I know for myself, I went probably a year, because mine was triggered in my master's program because of how I was managing the stress. And I triggered Hashimoto's in my body, and I just I couldn't get right mentally and emotionally. I literally wanted to, makes me really emotional, I wanted to die for a couple of years. I didn't want to get up. But I kept going. Nobody would have known. But there was this sense of what's wrong with me and what am I doing wrong? And I even went to go see a psychologist, and he was great. But it just so happened for me, so much of what was going on for me was stemming from physiological issues, but I didn't know that because I wasn't working with the right professionals. And so I did, like I think so many other professionals, I sat with that guilt and suffered. And I was lucky where I pushed through. I continued doing all my work. I made it through kind of without a hitch. But this is a real problem, and some people aren't so lucky. They have a bad day and they decide that's going to be the last day. They're going to choose into the suffering of being alive. And so this, I think, I know it touches me personally. I think you have your experiences too. And I think we've all known people who have not survived depression and suicidality. And so it's so important to talk about this because there's no shame around it. And yet there's so much stigma.
Mm-hmm. And there is so much shame. We say there's no shame. But for you, and I so appreciate you sharing this personal experience, and I'm curious for you, as you were getting your PhD and experiencing suicidality, did any of you question, how can I help other people if I can't even get it together myself?
Oh, 100%. By the time, luckily, I started my doctoral program, I had received the diagnosis of Hashimoto's the day I graduated from my master's program. And they're like, we're so sorry. And I'm like, no, thank you. But that wasn't the end of my suffering. Hashimoto's, while not deadly, while not threatening physiologically, or it won't cause you to die, there's a lot of suffering and there's a lot of struggles to really get to the heart of what's causing you to have depression, have anxiety, have fatigue, body aches, losing hair, all sorts of things, losing or gaining weight. But by the time I was in my doctoral program, I had a realization of I needed the right support, and there wasn't anything wrong with me, and I needed to manage my stress differently. But absolutely, through my master's program, as I was suffering and didn't know what was wrong and thought it was just me, something was wrong with me, I absolutely was like, what am I doing? If I can't even be okay myself, how am I going to help others? Is it even possible to help others feel better? I can't even get myself to feel better. I went a year or so before I even reached out for support, because for me, I was already so good at masking because I'd been dealing with untreated, undiagnosed ADHD for my whole life. Mm-hmm. And that also has stigma, which I'm trying to work past. But yeah, I really struggled with even knowing, should I be a therapist if I have my own stuff that feels so unmanageable? Luckily, I'm in a much better place now. But back then it was years of struggle, and it's sad that we don't feel safe to get help, and that whether it's clinics or sometimes even professors or other people can cause you to feel like, what are you doing here in this profession if you're not okay? When it's like, we're just human beings with our own struggles, but somehow we're not allowed to be human.
Right. We're not allowed, where the way that mental struggles are talked about behind closed doors is often really demeaning between each other, between therapists, really looking down on, we have these conversations about there's no shame, we shouldn't stigmatize mental illness or needing help from a mental health counselor, because you don't necessarily have to have a mental illness to need help, right? Yeah. But when you hear conversations from counselor to counselor about, oh, well, so-and-so's, they're saying they're suicidal, but they're just wanting attention, or they're self-harming for attention, or they're just borderline, or whatever it is, just being very dismissive of clients' experiences. It's dismissive of our own human experiences as well. surveys have shown that therapists experience, on average, more adverse childhood experiences than the average population. So therapists are already going into the field having had a rough go of it. And you hear these things tossed around by other therapists or by supervisors or even by anybody saying, oh, they shouldn't be a therapist, they need a therapist. As
Yeah.
if needing a therapist is an insult.
Or as if they're mutually exclusive, that if you are a therapist, you should never be seeing a therapist, or if you are seeing a therapist, you should never be a therapist, as if it's not a sign of health and self-awareness. No, absolutely.
Exactly. So an example that is talked about by Stacey Friedenhall, and she is unfortunately one of the only therapists who have really come out and talked about her own experience with a suicide attempt and with feeling suicidal. And she speaks about going to a conference for suicidality, and this is all licensed professionals. They're gathering. They're going to talk about helping prevent suicide. And one of the professionals there posed the question that in suicide-related research, there are a lot of people attracted to help out with that research who have attempted suicide or have experienced suicidal thoughts. And the question was, how do we weed these people out? Just really, a heart drop, right?
Yeah.
Even in that question. But what's even more sad, I think, is that the discussion was all around answering that question. Nobody brought up the concept that maybe these people who have actually experienced suicidal thoughts, who have actually attempted suicide, could add something of incredible value to the conversation, of incredible value to the research, that they're not just defective people that we don't want to be around, that we don't want to be involved in things. So as therapists, as mental health professionals, from each other, we get this feeling of, I can't be a real human.
Yeah.
If people find me out, then I'm not going to be qualified. I'm going to get fired. I'm going to get ousted. I'm not going to be taken seriously as a professional anymore. And we get that as well from our clients to an extent. But on the flip side of that, it also creates this feeling that Elizabeth and I have talked about before of that therapists aren't real people. So we get this idea that therapists, oh yeah, maybe you've read a book about this struggle. Maybe you've gone and gotten a master's degree or PhD and you've learned about people who struggle, but you haven't really struggled. And there is so much pressure to put on that air of, yeah, I haven't struggled. I haven't gone through anything. I'm perfectly fine. I'm the perfect human. But it creates this disconnect with clients where they don't see us as people. They don't see us as somebody who's experienced what they've experienced. And to an extent, yeah, we don't want countertransference. We don't want to be projecting our own experience onto them. We don't want them to be over-identifying with us and assuming that we know everything that they're experiencing because we've gone through something similar. So there's a lot of nuances there, but it creates this void of self for the therapist. We can't really be ourselves among our peers. We can't really be ourselves among our clients. Who are we? Where are we? There's a lot of fear and confusion.
Well, and when you brought that up to me, because I as well, when you were talking about people having this mentality, mental health professionals of, oh, well, if people are drawn to this particular topic because of their personal experience, how do we get them out of here? Like they are a liability, versus realizing most of us are in this field because of what we've experienced or what we've suffered through or what we've struggled through. It's the converse, I think, in many cases is often true, where we have actually been through something or many things that draw us towards this field of healing, not just to help other people heal, but often to heal ourselves, whether we realize it or not. And to think that, for example, DBT is a very well-known theory and modality at this point, developed by none other than someone who initially was misdiagnosed, and she's open about this, for anyone who knows about Marsha Linehan, but initially diagnosed with schizophrenia but later found to be suffering with borderline personality disorder, and who has developed from her experience and being hospitalized and suffering a modality that's one of the best recognized and one of the most helpful in helping other people suffering, in trying to just help them develop the skills to be able to stabilize, so that then maybe through other modalities they can go deeper, they can heal some of the deeper wounds. But this idea of treating people with their own experiences as a liability further adds to this stigma, because, well, oh, I have to pretend. Maybe I am drawn to it because I've had these tendencies in the past, but do I have to hide that? Do I have to hide that from my colleagues? Do I have to pretend that I am this blank slate, that I am empty, when truly we're full of experience? It's heartbreaking to me, and I think we've talked about it plenty. Corporations, bigger corporations who aren't necessarily always worried about the health and well-being of their employees, they will just cling to that. Yes, pretend you have no issues. Pretend you don't need normal vacations or breaks or lunches like other people do, because they get to benefit from this. And so I think there's toxic systemic pressures, and yet we'll kind of wear it as a badge of honor, like, well, I'll just pretend we have no mental health issues because that's what makes me a really good clinician. When maybe what makes somebody so effective is they have been through their own shit. And like you said, we don't make it about that in the therapy room because it's about us trying to help our clients, but that doesn't mean it doesn't exist, or that we should stigmatize it with our peers especially.
Right. Or that we shouldn't at least allow ourselves to explore it enough in a therapy session within ourselves to elicit empathy, right? To elicit the ability to understand where our client might be at right now and to pull out the correct tools to be able to help them, as opposed to just thinking strictly with the clinical mind of, well, you know, the research says that now I should say this. We have to be able to be human. And it's not just, it's so pervasive in the culture. It's so interesting. My mind is going back to when I was in graduate school, and there were 8 people in my cohort. It was a 3-year program. So we all got to know each other very, very well.
I bet.
Very well. And there was only one of us who didn't seem to have really experienced much in life and kind of had this idea of, well, you know, I'm a happy person, so maybe I can help other people be happy people. And I don't think that's the norm with therapists at all. For the most part, everyone had, you know, been through stuff. They all wanted to be able to help other people who have been through stuff. And the majority as well had seen therapists in their life. It wasn't this idea that you hear of, well, therapists become therapists because they're trying to figure out their stuff. There's more nuance than that. There's more duality than that. But throughout graduate school, I was in a really tough place where I was a single mom of I think 1 and a 3-year-old when I started.
Oh my gosh.
Yeah. And so by single mom, I mean like single mom. I was not receiving financial support at all from their dad. And he's not a bad guy at all. I don't want to make it sound like he's a bad guy. It was just, you know, how things were at the time. So I was taking care of everything on my own. I also got into an abusive relationship, a physically abusive relationship, and also mentally abusive relationship during that time. And the imposter syndrome of, I can't figure out my life. I am not okay. And being shut down consistently. I've always been a funny person. I've always been kind of the life of the party, and I don't think that that's like masking it all for me. I think it's a genuine part of my personality that I enjoy and I love, and it's what people grow accustomed to when they hang out with me. However, there are 2 instances that I am recalling from graduate school. One in a personality assessment class where we were all supposed to take a personality assessment, the MMPI. And I think it was a full panel because we were going to be assessing each other and it was practice. So everyone who's taken personality assessment classes or anyone who does personality assessments hopefully knows that if you are living with somebody who has a diagnosis, who is very unstable, your own personality assessment or mental health assessment is going to reflect that, is going to mirror that, because you are trying to adapt to them, right? So my personality assessment showed all kinds of levels of everything. And as we were discussing it, of course, it was anonymous as to whose was being shown. But as we were discussing it in the class, the comments that were made were cruel.
Wow.
About me, about how I was probably lying about everything, because how could somebody be that distressed, right? I was physically being beaten. I was in graduate school. I was raising kids. I was so stressed. I was not okay. But I was probably lying. And that's what you hear all the time about clients too who experience distress, because they look at it and they say, oh, this doesn't make sense in my schema, in my experience of the world. So they're probably exaggerating. Partially, I think, because a lot of my symptoms were somatic, which makes sense when you experience long-term distress. I had complex trauma from my childhood as well. Obviously, there were reasons that I was in an abusive relationship. So a lot of it was very, very, very pushed down. And so it makes it look like I'm just making it all up, or I'm really just okay, but so those comments. And then I believe it was the next year, things had gotten worse as far as, just a few weeks before I started my third year of graduate school. The abusive relationship hit a peak where I lost my 2 front teeth and had to go and get fake front teeth. And I was also starting my internship. So now I was waking up at 3:30 in the morning to get to the methadone clinic at 4 a.m. to work at my internship. And then I was going to school after that until like 7 p.m. And I was in constant fear of this person. He was my ex, right? There had been multiple calls to the police. There had been multiple restraining orders. None of that stuff matters. You can't just say, oh, I have this piece of paper, so now you can't come around me anymore. That it doesn't matter, right? So I was in constant fear of him just showing up anywhere, of, my kids being hurt. And of course, we know that, unfortunately, anyone who's been involved in the justice system knows that oftentimes calling the police makes it worse, right, instead of better. And so that was the situation that I was in at that point. And we were practicing group therapy in our group therapy class. And I was obviously, very obviously distressed one of the days, to the point where I think I was pressing my nail into my thumb because it was like keeping me from panicking and just keeping me present in the room. And the person who was in charge of the therapy, he was the kid, I say kid, he was the cohort member who was I'm happy, I'm going to help other people be happy. He looked at me multiple times and completely ignored me the entire time. He was facilitating the group. He was the one that was supposed to be asking people, how we're doing, how can we support you today? What can we talk about? He could see that I wasn't okay, and he consistently ignored me. So messages throughout graduate school were that, if you are not okay, you're going to be ousted. You're not going to be taken seriously. You're faking things. You're annoying us. So it's not different. It's not different in the mental health field than anywhere else when it comes to stigma, and it might even be worse.
Yeah. Well, and I appreciate you sharing that. That's something you hadn't shared any of that with me before, and so I'm kind of computing it in my mind, and I'm so sorry that you went through that, and makes me think too of, we had like a group therapy class in our master's program as well. And something similar where there was a lot going on in that group. One girl was struggling with infertility. I think someone was struggling with marital issues. I, at that point, didn't know what was wrong with me, but like something was wrong, and wrong is in my thyroid wasn't functioning, and I was depressed, and I didn't want to be alive, and I wasn't managing my stress well, and it was a challenge. And the group therapy session where we were supposed to kind of be checking in, but also like practicing group therapy skills got like too real. And I remember the professor, and looking back, I can see, I think she had things going on in her life, and, you know, she didn't seem like she was able to manage it well, but it turned into this shaming of our entire cohort. And like these serious meetings got called, and someone in another cohort had done something as well they were concerned about, but we all kind of got like vetted and shamed. And it was a meeting. There was a meeting too where I'd literally had, and nothing I went through in my program was anywhere near what you went through. But for me, it was very much, it was painful, where I was just trying to cope through a lot of things I was trying to process and move past, along with my current mental health issues in my program. And I'd had a moment where like I pointed out in front of our kind of school gathering that there were a couple of spelling errors on a piece of paper. And I one time had gotten passionate talking to a professor because she kind of carelessly said something to me that was triggering, and then didn't seem to know how to handle my trigger, which was to like more passionately defend myself. And so after we'd had this group therapy thing that was supposed to be helpful, but almost felt like it was used against us to act like something was wrong with all of us, or some of us. I had all of these things kind of thrown into my face, which like further stigmatized just being able to be a human being. Like these moments where I just allowed myself to be like, hey, there's spelling errors on this thing, you know, to actually have feelings and be a human being in a class and feel defensive, instead of masking so completely all the time. That was actually a moment I came home to my husband after that meeting, where there were benefits that I took away, I learned from it, but I also didn't feel I could stand up for myself. And so I just kind of sat and felt like I was just, the power imbalance was there. And of course now, since I've heard there were a lot of pressures isomorphically coming down from the top of the school down to these professors, down to us. And it was just this perfect storm of them not necessarily handling it well. And I have empathy for them, but I walked out of there like, I can't do this anymore. And my husband, I remember, he was like, I think you think the field is going to be like how school has been, and I think it's going to be different. And so don't feel like totally given up on the field, because it's not going to be like how school is. And that gave me hope. But I was to a point where I'd literally, I don't feel like it's oversharing. I think it's important to share this. I literally had a moment during that same time where I had told my husband, I said, if I died, you wouldn't have to cover the cost of my education, right? Like, you wouldn't have to. Because I was in this place of like, if I didn't exist anymore, I don't want to burden him with that. Then he was like, and I mean, he's my husband is the best. He's like, oh no, I would have to cover it. You need to stay alive. But I was that low, but even in the program, there was kind of this lack of me really getting the support I needed. There was almost kind of, like you said, and this wasn't all instructors. I love all my instructors, I really do. But I felt not seen, like you said, in that group by a fellow student. And probably most of that was I was very good at masking. Nobody ever has known something was up with me. And when I'm like, well, this is happening, they're like, what? But I felt like if I had been seen and it had been safe for me to be a human and have these struggles and talk about them, I probably could have healed faster. If I had known it was okay, because I had that fear too of if I'm too transparent. And that group therapy moment and those other little moments, what did they teach me to do? Put the wall up higher.
Ask even more.
Ask even more. And then we get into the field, and you and I have common experience of not such a great working
It doesn't
environment.
really get better.
And I mean, hence why we do our private practice, because I can make sure my life is balanced and I provide my clients with the care that they deserve. But the industry can be really toxic. And I think that we're all kind of victims of it, but then we can perpetuate it too, which is why it's so important we're talking about it and sharing. Because I'm to a point where, like, if me sharing my humanity drives anyone professionally or personally away from me, I'm very happy to let them go. Because people need to know it's okay. It's okay to be human. It's okay to suffer. We can make it through it. Sometimes we're suffering through it. It doesn't make us less. Mm-hmm. In fact, like the parts of you, when you talk about what you've been through, I see the interconnections of where, like, the beautiful parts of who you are absolutely rooted in how you've survived through these things. It broadens you. It doesn't detract. And it's so sad in the field that there's still all of this posturing. It's part of what makes me prickle being around, like I brought up before, different
like conferences, trainings,
because
big gatherings of mental health professionals. Mm-hmm.
Because I pick up on those vibes of all of this posturing and faking good. And it's so uninteresting to me, and it feels so toxic.
And then clients mirror that. They do that to us too. I see so many people talking about pretending to be better for their therapist. And I've done that too for my therapists.
Yeah.
And I always tell my clients, the goal of therapy is it's not to be happy. It's to be a whole human. It's to allow yourself to be a whole human and to be okay, broaden that window of tolerance. Speaking of DBT skills, right? Broadening that window of tolerance so that you can experience a wide range of human emotion and be okay and know when you need support and develop a sense of community where you can be authentic and be able to take care of yourself and lean on others, right? We need to be humans. We need to be whole humans. In my experience, when I started seeing a therapist, I think it was my last year of graduate school, I started seeing, it was my second year, probably halfway through. And he was great. I loved him. He is fantastic. He is a psychodynamic therapist, which is definitely what I needed at the time, because in psychodynamic therapy, they kind of help you elicit emotions and feel them in the moment. And I had blocked off so many emotions for so long. I could do CBT all day long. I could talk about different perspectives. I could analyze everything. That was never an issue. So for so many therapists, it was like, oh, well, what's the issue here? You seem to have it all figured out. Well, cool, but I don't feel okay at all. So with this psychodynamic therapist, he was able to help me feel emotions in a space that was safe, which was great. On the other hand, there were times that I wanted to bring up something deeper, like suicidality, like feeling like there was something deeper going on that I just couldn't get a handle on. And he pretty consistently brushed that aside. And I've wondered why. And part of me is curious, is it because I am so quote unquote high functioning? Right? As therapists, we want to see each other as okay because we want to be okay ourselves. Yeah. We don't want to think, oh no, here's this unstable therapist, and what does that mean about the field? What does that mean about me? Yeah. It's so much fear. There's so many tiny little moments throughout becoming a therapist that we see that it's not okay to be a human. And then from the client end, right, we've talked about that they don't necessarily see us as humans, but there's some level of concern there as well, where a client may feel, well, if my therapist can't even get it together, then what hope do I have to be able to get it together? And that's where I really feel like there has to be a shift in what it means to be healthy, what it
Yeah.
means to be okay, and what it means to see a therapist, and what it means to be a human who is a therapist. Therapists aren't wise sages that are above the everything, right? We're medical professionals who learn how to use professional skills, and our personal life, of course, allows us to do that in a better way. Similar to a doctor learns medical skills, and a lot of doctors, say a cancer doctor, they might have decided to specifically become a cancer doctor. And I know there's a specific name for that, but it's not coming to me right now. An oncologist. There we go. They may have decided to become an oncologist because they had a personal experience with cancer, either with themselves or with someone close to them. And that makes them more empathetic. It makes them care more. However, it is not that personal experience that gave them the skills to treat the cancer. And if they get cancer themselves, they are not less of a cancer doctor. Unless it impacts their brain functioning eventually, right? But they're not, if a dentist sees a dentist, they're not a worse dentist.
Yeah.
This is something that seems very specifically in the mental health field.
Yeah, and I know we've talked about it before, you've brought it up before, that I think in many ways we do it to ourselves in the field, and we perpetuate this idea, and maybe it's like you said, we're on a different level, we're trying to validate our own relevance. Like, to me, it feels like something you do from a place of insecurity. If I can't acknowledge where I might struggle or suffer, or just like everybody else, have average human issues, problems, struggles, mental health, symptoms, I'm like, what am I trying to prove? And why in this field do we have this strange false belief that to be effective or to be capable, we have to be without any of our own struggle? Like you said, it's a very strange belief. And in talking about the recent events here locally with a professional, and even when you brought it up to me, it made me think of a particular, I think he was a psychologist back in 2019, who, not here in Utah, but in a different state, was overwhelmed by his work. And he was even, one of his areas of expertise was resiliency. And I listened to a talk of his this morning talking about resiliency, and I'm running through my head knowing what happened with him as he's talking about his life and his work and his children. And to wonder, even for him being at this certain level of accomplishment and working at a college in their mental health and counseling over that whole program, and he takes his own life because of stress, because of overwhelm. And I think about how many of us are building towards something catastrophic like that if we're not openly talking about what's happening for us, if we're not openly getting support for our mental health issues. I know for me, one of the most liberating and helpful things was, obviously I have an incredible spouse who I can talk to anything about, and who's non-judgmental and supportive, and always kind of comes from this place of love and, hey, how can we help you feel better? But what happens when professionals are just holding it in? I think some of these cases we see, some of that might be playing into it. And how can we change that if we continue to posture, if we continue to, in our clinical meetings, have these games of who's the most professional, unhuman, perfect individual, or stigmatizing
each other instead of supporting each other.
Yeah. And how do we go about changing it? I think part of it is talking about it. Like today, I know I didn't plan to share the things that I've shared so far. I'm not sure if you did, but I'm happy we've shared them because they're relevant. And I do view us as two competent, capable, and striving to continue to develop ourselves professionals. And I know if we've experienced it, I know others have too. Mm-hmm. And my hope is we can try to help break through that wall, because I know for me, if I hadn't have had my husband's support or other people who were safe that I finally started to talk to about what was going on with me, I don't know if I would be here. Mm-hmm. I hadn't gotten so far as to plan or to have a means and a way but I just know I was on that path of not wanting to be here, and I couldn't undo it myself. I had to have the help of my doctor. I had to know there was something I do, and I had to know it was what was happening to me made sense for some reason, and it was stemming from something that I could try to do something about. But if we don't talk about it, I think just the guilt and the shame, and we continue to go, like you said, imposter syndrome. What am I doing here? People are going to find out. And I think the pressures of some of these institutions, like I wonder at this college where this guy was working, he was working there, this particular professional, he was called in to supervise because they'd had like 14 suicides of students at this college. And he goes, and what happens? Right? And I wonder if there wasn't some systemic pressure that was contributing not only to the students to have these responses, but him.
Right. Similar to the same issue that we see in Alpine, Utah, where there is just an insanely high suicide rate and a lot of community pressure, a lot of pressures from different angles in Alpine. And we could definitely talk about that more another time. And I think there's always a balance when it comes to mental states between personal responsibility and community responsibility. So I don't think that as a community we are 100% in charge of each other's mental well-being and each other's choice to continue living or to not continue living. I do think if we write it all off as a disease, as an illness that is purely within the person, that there's nothing anybody can do about, and their suicide or their behaviors or whatever happens is inevitable, then we are majorly failing each other.
Yeah.
And that's where this conversation is so important, is we can talk about clients as the others, and that, there's no shame in them getting therapy. There's no shame in suicidality. There's no shame in any of that. But until we start having conversations with each other like this, that are real about ourselves and show by our actions, by example, what it looks like to work through it, to get help, then we're just part of the problem.
Yeah. Well, and it makes me think of, I have a couple of awesome clients, and they happen to be therapists as well. And they've talked about in their own process of coming to therapy, how much that has broadened their understanding of what the experience is like for clients. And again, I share that from a perspective of, there can be this weird stigma of like, well, if you've had issues that are too serious, like, what are you doing here? You shouldn't be in this field, or you automatically are here because you're codependent, or there's something wrong, versus maybe there's something so right with the wounded healer. That idea of through facing and acknowledging our own pain, that's maybe where we become the most effective, like you said, to have empathy, because it's easy as a clinician, when you've never been on the other side of the chair, you've never faced your own stuff or seen a therapist to get support. It is so easy to take for granted what it is to actually be acknowledging your wounds and trying to work to heal them. I think there's so many ways that we take things for granted. There are family members I've had who have been shamed by therapists because they were so mentally, emotionally engaged in certain really serious issues happening in their family. And the therapist had the luxury of going home and not facing any of those realities for themselves, to kind of go, why are you worried? Why are you so worried about that? Mm-hmm. And I think when we address our own issues and we seek healing for them and we acknowledge them openly without shame, we, like you said, we become more whole. And just in the realm of being a therapist, I believe that makes us far more effective at what we do in all sides of that, whether it's empathy or in, delivery of intervention or honoring our clients' humanity. But as human beings, at least last I heard, and for marriage and family therapists, I don't know if this is true, I should have looked it up, but I think our divorce rates are higher than the average other individual who's a non-marriage and family therapist. And I look at that and I go, something's going on here. I have all the answers for everyone else's marriage, but what about mine? What about my relationships? And I wonder if there isn't a part of that masking. And we can buy into it. We can literally think, I am infallible. I do have everything figured out. I don't have anything wrong with me. And that's intolerable to live around. And also it gets in the way of us healing, because we all have something or some things that are wounding us, that are holding us back, that are unresolved. And to pretend we don't it's just outright, it's a lie. It's a fantasy.
I think that's a really great segue into the next part of our discussion. This situation that just happened in Utah, this tragedy, is complicated, and more complicated than suicide itself.
Yeah.
And unfortunately, so many therapists are involved in heinous acts, or medical professionals involved in heinous acts towards other people. And in this conversation, our desire is to stay away from any kind of analysis as to why an individual might commit heinous acts, partially because it's so quick and easy for that to devolve into gossip, and also because without the person sitting here, we really can't analyze. We can only assume. We hope to not get into analysis of why somebody with power commits these types of heinous acts, or why a therapist might. And we also, although it is very pervasive and very prevalent and a very real issue, that the criminal justice systems and the licensing divisions do not respond to allegations of abuse in a way that is effective. That is not this discussion that we are having. What we hope to address specifically in this discussion is the component that can contribute to these types of behaviors or environment that stems directly from being a mental health professional and experiencing that stigma and that hollowness that comes from feeling like you can't be a real human. Whether it's with your clients, with your peers, with your supervisors, with your bosses, and even at home, with your friends, with your spouse, where you have to hold this space of confidentiality for everything that you experience during the workday. And you have to show up as a parent, as an aunt, as an uncle, as a friend, and you have to be okay. So there's this slicing off of yourself. No matter which chair you're sitting in, you're not allowed to be a whole human. That's specifically what we want to address here.
And I know for me, as you're describing that, and I'm thinking of how I manage that and how that impacts my life, I know some of the residual impacts even now, as I'm in such a different place than I was before and feel so much hope and excitement for the future. And I know for me, I notice a lack of patience. I notice kind of higher levels of aggression. And not that I act on them, but internally, frustration at other people. I notice that when I'm not giving appropriate outlet to these, I'm not acknowledging what I'm really feeling, or if there's something off, or if I'm suffering, if I'm just masking it everywhere, or abridging myself and cutting off certain parts of myself in all of these settings and never allowing myself to be a full human being, I notice that I become a little more kind of callous and a little more isolated, and I just kind of want to be away from everyone and everything, versus when I'm talking about it more actively, I'm acknowledging it. I'm being open about what I'm experiencing with other people, and it alleviates some of what otherwise literally turns to poison for me inside of me. And I know as we reference, and we intentionally are not specifically referencing names in some of these issues, but as we're referencing them, these are the things that come up for me as I wonder from a sympathetic place. Were these individuals experiencing any of that, amongst other things? I think too, probably the more, I'm trying to think of the word, exposure someone gets, I think that maybe the more notoriety, maybe the more power or the more training, there's got to also be this high level of pressure that I've got to be beyond these small issues. And so I think that can come out in ways towards ourselves or towards our family members, especially when I've had like difficult caseloads or difficult things happening in my life, I have to pay attention to slowing down and being careful, because those things can bleed out onto our family members. And I'll notice I'm more short with people, whereas I can be just the infinite well of patience with my clients. But it's so essential that we stop the faking and we stop the masking and we stop pretending we don't have real issues as clinicians, because it only hurts us and it only hurts our families and it only hurts, I think, our clients as well. Because if we think there's not a cost to keeping that inside and it festering, and in some of these outlier cases, we see these horrifically sad situations where people take their lives or act out towards others. I hope to gain more insight into understanding how we can help prevent some of that. And like you said, there is absolutely personal responsibility, but we are so much also in many ways at the mercy of our societies and our communities. And if we're not made to feel safe, if we're not allowed to cry and share about our real experience without feeling somebody's kind of whispering off to the side, oh my gosh, and that takes away from our credibility, these issues will continue to happen, I think. And it's like, when are we going to learn? I don't know what's helped you to manage that in your life, manage that human part of you and starting to actually let it breathe and have life versus caging it up, as it feels like I've experienced.
It is a struggle. It's hard to, for all of the reasons that we've already talked about, and some that we've talked about in previous podcasts as well, where being a human and a therapist is hard, not just because of stigma, but also because of just real hard tax stuff of how many clients do you need to see a week in order to make a good enough income to be able to engage in the self-care that you're telling clients to engage in. For me, yeah, stress can come out sideways as being snippy, as being agitated. And of course, just like any power structure, things come out sideways at the least powerful person that you encounter that day, right? So retail workers are typically, I don't explode at retail workers, but retail workers, I like to take the self-checkout because I can tell it to fuck off.
You could explode it yourself. No,
Yeah, it can tell me to put the item in the bagging area. You put your fucking item
have a
in the
nice fucking
bagging
day.
area. Fuck off. But retail workers experience all the time aggression from people.
Yeah.
And unfortunately, part of that is because they are the bottom of the totem pole that person is going to interact with that day. And as crappy and as terrible as I feel about it, I have snapped at my kids because they're being kids, but I'm stressed, right? And of course, I apologize it and I do that repair work. But I have found that within myself. For me, leaving mainstream mental health and working in my own private practice where I'm able to do things in a way that is much less stressful for me and provide care at the level that I want to be able to provide care has greatly reduced that. And at the same time, I have the privilege to be able to do that now because I have remarried and my spouse provides health insurance. And here in the US, health insurance is attached to having a job, which I don't have a private practice. So I would not have been able to do that had I not been remarried to somebody who does provide health insurance. So that conversation of self-care within the mental health field and acknowledging, what we need to do, what the kind of environment we need to provide for therapists to be able to actually take care of themselves and to not be so stressed, I think is vital. And then the conversations behind closed doors or even in public. There's a really great book by Dr. Alan Francis called Twilight of American Sanity. And in this, he talks about a lot of really great relevant things, but one of those things being, and I don't want to get into politics at all here, but specifically he talks about that he wrote the criteria for narcissistic personality disorder in the DSM-4, and it stayed the same since then. And we can go into diagnoses a different time and politics another time, but the news outlets, several news outlets, reached out to him in 2016 asking him if Trump was narcissistic. And his response was, nobody should be engaging in trying to diagnose somebody who's not their client, who they can't do an assessment on. So he didn't diagnose. And he goes on to talk about that if we're looking at our society in general right now, there are so many prevalent issues when it comes to mental health and writing people off because they might fit into a diagnostic category, instead of taking responsibility as a community and saying, what are we doing about this prevalence that's happening here? Why are we experiencing in our country so many rates of so many prevalent issues that maybe other countries aren't, right? So those conversations where we might just offhandedly, in a tone that sounds like we're writing somebody off, say, they're just a narcissist. Mm-hmm. They're just antisocial. That's just, how they are just ill in one way or another. And I've been seeing that in this case. There was a case also in 2022 of a therapist who was involved in some ritualistic abuse situations. Mm-hmm. And it's so quick, it's so easy. I think we like a sense of, well, that's them, not me, or that wouldn't happen to me. We like to have this sense of control.
Yeah.
And if we write somebody off as almost not even a human, it's really easy for us to maintain that sense of control. But it really blocks us from being able to have these conversations or somebody being able to go in and get help. One of the really big stigmas within the mental health field, and one of the big populations that has a hard time finding somebody who can help them, is people who experience pedophilic tendencies. And those people need help. They need to be able to feel support. So if we as mental health professionals, if we as a society are just hating on them and shaming them and making them out to be these giant monsters that don't deserve to live, we're blocking them from getting the vital help that they need in order to hopefully not harm people.
Well, and I know another population that a lot of professionals aren't equipped, mental health professionals, nor do they have a desire to work with, are people suffering with borderline personality disorder. And I understand why. The symptoms can be intensive and they're interpersonal, and so they're going to come out towards the therapist. But I feel like as part of this conversation, part of allowing ourselves to be humans as therapists and to have our own scruples and our own issues and limitations is to be able to say, hey, I may not ever, because of personal things I've seen my family go through, be able to have the sympathy and empathy or care to work with somebody who suffers with pedophilia. Someone else can do that. But you know what? I'm really well equipped. I know how to help people, and I have the threshold to help people suffering with borderline personality disorder. And I think as therapists, part of the other toxic side of not being able to have our own issues or be human is not being able to say in a more kind of professional, acceptable way, I don't want to, or I don't like working with these particular populations. While people do that, in some settings, it's almost kind of like, what's wrong with you? As a good professional, you should be able to work with everybody. Mm-hmm. And you know what? Maybe we're all not well suited to work with everybody. You're even more into the specialization and really embracing what you're really good at and where you really thrive. I tend to be more general in who I work with. And I know you work with people with general issues as well, but you tend to specialize even more. And I think we need to stop shaming people who go, hey, that's not my bag. That's not my thing. I can't provide meaningful care there, but it doesn't make me less of a professional. Or less capable of helping people. And I think all around, again, there are all of these false perceptions that are internally perpetuated. I think they're utilized, again, by sometimes organizations and it doesn't just happen in our career It happens for others. I just had a conversation with the nurse the other day, and there's shaming that happens there too, when people just want to have a lunch, take a break, want to work in an environment where there's more balance, where they're not just run ragged every day. And so I hope we can continue to have these types of conversations. I know I was so happy, sad, but happy that you had the forethought to say, hey, we need to have a conversation about this. Because while it's sad when events happen and we see people act out, hurt themselves, hurt others, I feel like those wider topics that some of them we've talked about today are really important. More conversations need to happen where we also, by example, humanize ourselves and invite others to have those conversations. And I would say we would love to have deep, real conversations with other professionals out there who might have meaningful things to say about these topics, or might be willing to also get real and share about their experiences to further the normalization of that we have these struggles too. We suffer with depression, suicidality, we suffer with anxiety. We have relationship problems too as therapists. And it's not helping anybody by pretending we don't.
And we are worth getting help for us. We are worthy as ourselves. I hear often, in fact, I've tried to have, groups or retreats that are just for therapists, just for mental health providers. And the feedback I often get is, well, will there be training involved? Is this a CEU credit? As if our only value is for our clients. And if we are not doing something that we can translate to caring for our clients, it's not worth doing. But if we could get any message across to you all today, other therapists, other mental health providers, psychiatrists, neuropsychologists, whatever it is that you do, you are worthy all by yourself. Even if it doesn't benefit anybody else, you're worth getting help for. You get to have a life that you love because you deserve it, because you're worthy of it. Even if you make mistakes, right? Hold yourself in the same space that you hold for your clients. We have all had those clients who don't feel worthy, who feel like they have just made so many mistakes, taken so many wrong turns in their life that they couldn't possibly be lovable, that they couldn't possibly be okay. And yet we sit there with them with the most profound love. Give yourself that space. And Elizabeth, I so appreciate you having this conversation with me and being so vulnerable and so open. And I'm glad that we had this conversation. I hope that it's beneficial. For Elizabeth and I, we both work with therapists as clients, and we've talked about this before, and Elizabeth mentioned it earlier. We both view it as a strength. We both love helping fellow therapists, and there are other therapists out there who feel the same way. So even in the comment section, if you're a therapist who sees other therapists, and especially because unfortunately of the stigma in our professional places that we work of having diagnoses, especially if you're a therapist like Elizabeth and I who don't work with insurance, we don't diagnose, there won't be anything on your record with any kind of official diagnosis, raise your hand so that we all know where to get support from.
Yeah. And kind of building off of that, of what you just said, if anyone has any topics you feel it could be valuable for us to talk about, that you want to hear our perspective, or again, if you want to come and join in on the conversation, we would love for that to happen, because the more of us that are talking and sharing, the more safe I think others might feel to join in and to know that it is possible to be a therapist and a human being. In fact, it's essential if we want to accomplish what I think most of us, the well-intentioned of us in this field, are hoping to accomplish, which is to help other people. Ourself is the most powerful thing that we can bring to the table, obviously honed and sharpened and in some cases refined with those therapy skills and education. But if we're leaving that out, we are leaving out an essential component to really helping other people. And also, I think, to having joy and fulfillment in the work. So thank you, everyone, for being a part of this conversation through listening to what we have to say. We appreciate your time, and we send love and support to you. If you're struggling, get support. If you need help, you deserve it.
We don't need no miracle. I think we've seen